السلام عليكم جميعا. سعيد ان انا معاكم. ان شاء الله احنا عندنا سيشن لطيفه كده عباره عن حالات، وهنبقى بنتناقش مع البانل استاذه الدكتوره منى سليمان واستاذه الدكتوره عبير والدكتور احمد، وهيبقى معانا دكتور البرت من اللي هو الفايس بريزنت بتاع الاي اس ال دي، وبيتر اللي هو البريزنت الكت بتاع الاسكاد، هيبقوا معانا اونلاين ان شاء الله عشان نناقش الحالات دي. فباذن الله تبقى يعني مناقشه مفيده باذن الله. دكتوره منى اهلا وسهلا بيكي، ودكتور عبير.
صباح الخير وكل سنة واحنا جميعا طيبين. والحقيقة يعني المؤتمر يعني كله شكله كده مبشر، وكل حاجة فيه متميزة حتى المواعيد بالدقيقة، ودي حاجة كويسة. وبنشكر الدكتور مصطفى على هذا المؤتمر والدكتور أشرف على السيشن دي، وإن شاء الله تكون مثمرة وتستفيدوا منها كلكم، وإحنا نستفيد من تجاربنا مع بعض.
احمد، هو البرت وبيتر موجودين؟ احنا نقدر البروجكت ده
حصل لوجن من دكتور البرت ودكتور بيتر. دكتور البرت اونلاين. اوكي، عايزين بس نظبط بقى الاوديو فيجوال ان هو لما يدخل معانا في البانل ديسكشن يبقى معانا على السكرين.
هينفع نبقى السلايد موجود وهو موجود؟ اوكي طيب. So let me just start with a short introduction about the ESLD. It is the European Society for Lasers and Energy-Based Devices. This is a non-profit organization dedicated for education in the field of lasers and energy-based devices all over the world. What is really يعني makes me very proud, and the largest number of members of the ESLD and of the ESCAD is from Egypt. I really thank you for your support, and I hope to see more active members from Egypt, because this is how the society would grow. The society is doing multiple activities. One of them is a monthly meeting where it's called ESLD Thursdays. Every Thursday of each month there is a session about certain topic. For example, tomorrow we are going to be discussing the NDAG, everything about the NDAG, its applications, how to set the parameters, and so on. And every month there is a session like that. Besides that, there is a very important activity of the ESLD, which is the teaching courses. For the past 2 years, it has been virtual due to the COVID. However, next May, we are going to have the first physical course in Ljubljana University in Slovenia, just 2 days before the spring EADV meeting, where it's going to be in Ljubljana, and it's going to be an outstanding program where we are going to have something very special, never taught before in the ESLD teaching course, which is the endovenous laser treatment of the veins. So I think it's going to be very exciting. The ESLD is providing free membership for residents and postgraduate students. So anyone who is studying dermatology, whether for master or MD or whatever, is eligible to get free membership of the society. So I really encourage you to join the ESLD. This was one of the teaching courses which was in just before the COVID, and we had 2 successful days. Usually it's 2 days, and there is theoretical sessions and hands-on sessions with all the speakers. The next one, as I said, is going to be in Ljubljana University, 10th and 11th of May. Whoever is able to attend, this is going to be an outstanding opportunity. Ljubljana is a very nice city. This is the University of Ljubljana, and this is the city overview. So I really encourage you to try to attend if you can attend. And this is the email of the society. If someone is interested to communicate with the society, you can do that. Now, we are going to start the topics of this session, where the title is What Works Best in Dark Skin. And the first topic I would like to present or discuss is the laser assist hair removal. I think this is one of the oldest laser applications, but still sometimes we have challenges, we have problems, complications. So we'll start to discuss this. I don't know if Albert is online with us. موجود. Can you present it? ممكن نحطه على الشاشة ولا لا؟ This is Peter. طيب لحد ما
Yes, I'm here.
Okay. Hi Peter, how are you?
I failed to open my camera for some reason, but I'm fine. I heard your introduction. I'm fully available.
Excellent. Okay. الكاميرا هو مش قادر يفتحها، تقدر تعمله هو ده هوست، اعمله هوست من الزوم. Okay, it seems that the problem is that from your end, Peter. If you can open it, it's fine. If not, we are going to deal with it without the camera. So, Peter, in your department and in the places you work, definitely you have cases for laser-assisted hair removal, right?
Of course, yes, many of
Okay.
them. Yes.
And you have patients who are having dark skin.
Also, yes, many.
Excellent. Okay, number one, when you have patients with dark skin, is there a certain preference for the laser type you are using, or anything works anywhere?
No, well, when we encounter patients with skin type of 4, 5, 6, we never use any other device than the long pulse anti-YAG laser. So that's I think that's mandatory, but that's what we do, and we have some other tricks, but maybe I can discuss them later. But it's the anti-YAG laser, the
So the
1064.
I think this is a very good answer. The other option maybe which can be valid is the diode laser. Dr. Mona and Dr. Abir.
I believe that if you have the choice to choose the device, it will be long pulsed Nd:YAG. But if you don't have the choice, you can manipulate or modify your parameters in order to suit this dark skin. So I usually increase the pulse duration, use ice or cooling, and decrease the flows, and it works.
With what wavelengths or what type of laser?
I can do with any wavelength.
Any wavelength, whether
Yes.
Alexandrite or
Or diode, I can do this.
I agree with this. I use usually the long pulse Nd:YAG and diode laser,
okay.
and adjusting the pulse duration up to 100 or more than 100 milliseconds.
Perfect. Okay. Albert, are you with us?
Yes, I just joined.
Okay.
Sorry,
Perfect.
I'm late. I also have clinics. I might be called away, but I'm just here
Okay.
just
Thank
this
you.
very moment.
Thank you very much. So we are discussing the best wavelength to be used for dark skin for hair removal, and everyone agreed that the Nd:YAG is going to be the best. However, here we have a problem because the Nd:YAG is safe in dark skin because of the low affinity to the melanin. However, when the hair is becoming fine, which is going to happen after a few sessions, the Nd:YAG is not going to be effective. So what do you do at that time? If you have a patient with dark skin and the patient is presenting with fine hair, or the hair became fine after a few sessions, what do we do at that
Yeah.
time?
Well, that's a very good question. And I mean, it depends also on the skin type. If it is skin type 5 or 6, I only use the Nd:YAG laser, and I would simply decrease the pulse duration, shorten the pulse duration. Although there is a limit to that maybe, because at a certain moment, maybe the pulse duration is too short to heat up the hair follicle that is around the hair, because the hair is the chromophore, but the follicle is the target. So I'm not sure about that, but I think that would be my approach.
Okay, so we use a shorter pulse duration and we use a bit higher fluence with very good cooling in order to protect the skin. This is your
Yeah.
approach.
Yeah.
Did you ever use the Q-switched Nd:YAG in that case when the hair is becoming a little bit fine in order to get hair bleaching and then, you know, affect the hair? Is this an approach you have tried before?
Yeah, I think I heard it, and I heard it from several experts. I have no personal experience with this approach, and you will get hair bleaching. I don't think you will get permanent hair removal,
Yeah.
but
there is-
maybe that's a choice. Yeah.
Yeah, okay. Dr. Amona,
For
Dr.
the fine hair which become lighter in color, you can use in skin type 3 or 4, not more than that, with Alex.
Okay.
Alex.
Okay, with the Alex we can do
Yes.
that. Okay.
We can use the intense pulsed light in the fine hair with dark skin, but carefully, and it will work.
with
on my-
long pulse IPL. I mean, you
Yes,
extend the pulse
IPL.
duration.
Yes.
Okay.
Yes.
Ahmed, do you have any comment?
Yes, I agree to all what have been said regarding the different laser devices, but also there are some technologies with some devices that help with the fractionation of the pulse. Let me phrase it this way, where we not introduce the full fluence to the skin instantly, but it is introduced to the skin via different pulses with some time allowed for cooling of the skin in between those pulses. So let's say if we are going to introduce like 40 joules to the skin, they are applied in like 5 consecutive pulses with millisecond fraction in between each one, which creates more safety to the skin. Also, there is one device that I work with which creates suction on the skin, and this leads to decreased fluence used to achieve almost the same result. And there are some tips where I can also introduce more than one successive pulse to the skin while letting cooling of the skin in between. This will help to create a more safe practice regarding the darker skin types.
Okay. Now, the question is to you, Ahmed. Have you seen paradoxical hair growth?
Yes, definitely.
Okay, this is most common site of the body. Where?
Mostly in the face.
Most of face and neck.
Yes.
Okay. And when you do see paradoxical hair growth, what do you do?
Actually, I revised the technique that has been introduced to the patient, whether it was a proper technique, whether there was a proper coaptation of the hand piece to the skin for regarding the fluence, to make sure that it's performed in the proper way. This is the first thing. If everything is going fine and still I am facing this condition, I go for discussion with the patient and try to persuade her to have a pause till this paradoxical hair growth is stopped and eventually reversed, and then we discuss the other option that we can have.
Thank you. Peter. Peter?
Yes, yes, I'm
For
here.
paradoxical hair growth, have you seen cases of that?
Yes, of course, we've seen that. And for me, it's a big burden, I must say. I don't have a good solution for that, other than trying to optimize the conditions and go for higher fluences. But there's a limit to that, of course. So, well, with regard to the dark skin, I think you can go with higher fluences if you cool good enough. So the cooling of the epidermis is mandatory, I think. And also maybe you can slow down your frequency of pulsing, because then you give the skin more time to lose its heat. But for paradoxical hair growth, well, I don't have the real solution.
Okay. Have you ever seen any cases of paradoxical hair growth in skin types 1 and 2, or it's only in the darker skin types?
Oh, that's also a good question. I don't really recall, now you're telling me that, in any of those light-skinned patients, no.
Yeah, actually it is very difficult to see that in fair skin, because in fair skin we don't have a problem. When the hair is becoming fine, we can go very aggressive, increase the fluence, reduce the pulse duration, and we are not having any fear on the skin. The problem is in the dark skin, because when the hair becomes fine, if we raise the fluence and decrease the pulse duration, then we are going to burn the skin. And that's why we have to be conservative. When we are conservative, then instead of selective photothermolysis, we can induce photobiomodulation, and this is going to stimulate the hair growth. So it is not recorded in fair skin, it's only in dark skin. And as everyone agrees, we have to reduce the pulse duration and increase the fluence with very good cooling. Using the cold air cooling is a much better approach, because it is bulk cooling. It's cooling the skin before, during, and after the laser pulse, so it is cooling all the area. But if we are using the cryogen spray or the contact cooling, then it's only at the site of the pulse and not the surrounding area. So it's really very important to cool not only the site of the laser pulses, but the surrounding area as well, to minimize that. Of course, it's very important to make sure that there is no underlying pathology, because if the patient is having hormonal disturbances or polycystic ovary, then we are going to have higher incidence of paradoxical hair growth. So those are things which are really very important to consider.
So I want to add something, Dr. Ashraf. So from the beginning, you have to choose the optimal energy for the skin, and not to be very low or very high, to adjust the energy.
The right
exactly.
energy, of course. The last question I'm going to ask before we go to move to the next topic is the post-laser folliculitis. Sometimes patients are complaining of acneiform eruption at the site of the laser hair removal. Is this something you experienced, Dr. Mona?
Sometimes, yes.
Okay.
Sometimes.
Dr. Abir, can you explain why it happens?
No,
and what
I usually see this only with RPM glass. I haven't seen it with
hair
with
removal,
hair
with
reduction
hair removal.
ever. Yes.
Okay. Ahmed, did you see that?
Well, not usually, but I've seen patients suffering from this, especially after Alexandrite laser. With diode, I don't usually experience
see
this at all.
Okay. Albert, the post-laser hair removal folliculitis or acneiform eruption, did you see that?
Yeah, I see it, but it's not permanent, and
Yeah.
it will improve typically spontaneously. So I don't find it really a clinically important issue. It is there. On the other hand, the paradoxical hair growth certainly is an issue, and if you look at the literature, it's like 10% of the patients who are reported to have that. So, but folliculitis, I don't see as a problem really.
Okay. Peter, if you had a patient who had this post-laser folliculitis, how do you handle them? They are coming, they are not happy, they paid money to get hair reduction, and then they have acneiform eruption. So how do you handle them?
Yeah, well, I usually give minocycline. That's the best option, I think, that comes from literature as well. And then probably not because of the
Bacteria.
antimicrobial, the how do you say it? It's not killing the bacteria, but it's anti-inflammatory. And in that respect, it works in these cases. I agree with the other doctor that we see it with erbium YAG and CO2 much more frequently, but we sometimes see it with hair reduction laser frequently.
Okay. From my point of view, when we have this reaction, it's more of a foreign body reaction. It is just like the patients who are having pseudofolliculitis barbae. What happens when the hair starts to grow back towards the skin, penetrates the skin, and then the body is reacting with that hair as a foreign body, and then we have a foreign body reaction. So that's why I don't think the antibiotics as antimicrobial effect will do anything. It is something which, as we hear, is going to subside, is going to diminish by the subsequent sessions. We need to reassure the patients, and sometimes if it is really annoying, we can ask the patient to use something like Fusicort for 2 days before the session and 2 days after the session. It's going to minimize that reaction, and reassurance is a key. Sometimes patients who are having curly hair, this is going to be more common among them, and usually in skin type 3 and 4 and darker skin types are more common. Ustaz Dr. Mustafa, yes.
First of all, my thanks for this very nice session about something in our daily practice. Thank you, Dr. Ashraf. Thank you for our boards. I think that post-hair evaluation folliculitis in some cases may be due to the patient's already acne-prone patient. This first. Secondly, if there is active lesion of acne, even if it's very minimal, and all of us know that acne is an inflammatory disease disorder from the stage of pre-comedonal stage. So we must take a history and to be guard about this point. Second point, my question is, what about laser hair removal in certain skin disorders like that vitiligo, pyoderma gangrenosum, systemic lupus, acne rosacea, atopic dermatitis, بالتحديد laser hair evaluation, and what better to use in certain cases? I think it is important to give the message about, or the answer about this.
Okay. We are going to hear the comment of Peter and Albert about the last question of Professor Dr. Mustafa. However, for the first part, which is the explanation of the acneiform eruption from your side, I totally agree. And that's why it's important to be a dermatologist to use the laser. I mean, without having this background, you are not going to manage the case well, diagnose the case well, use the right protocols and treat the complications or the side effects. That's why it's not appropriate that beauty salons are using hair removal and using lasers. This is not appropriate. It is really very important to be a dermatologist to be able to handle those dermatological conditions and problems appropriately. So definitely this is something to be considered. Albert, there was a question about laser assist hair removal in patients who are having some diseases like systemic lupus, like vitiligo, like other atopic dermatitis and so on. Is there any concern, or do we do it without a problem? We'll listen to Albert and then Peter. Albert?
Well, maybe I can start.
Okay.
I think Albert, because he put out his
Yeah,
photograph,
maybe
is
he's away. Okay,
called
Peter.
away.
Yeah.
So yes, but this is a very good question, and actually I don't have a real answer. It depends on the patient, of course. So if I would be confronted with a patient of active skin lupus, I would not go over that region with the laser in fear of activating the lupus even more. With a vitiligo patient, when the hairs also have no pigment, of course, it doesn't make sense to do any hair removal with laser. So, but in other areas, I would also be very cautious with using the laser in fear of getting this effect on the vitiligo and provoking any more lesions there. Well, and that also goes for atopic dermatitis, I think, especially in patients who are very active and who are in areas that are prone to develop eczema. I would be very careful, actually. Yeah, so, but those are not real contraindications. But in general, when you're confronted with these patients, you have to be careful. That's my opinion.
Okay. Dr. Abir, I think she had a publication about treating patients with lupus with a laser, so you can comment on some of those issues.
This question is very, very, very important, really, and it highlights a very important aspect to take care of. First, the systemic lupus, if it is presented with discoid lupus without systemic activity, it will respond and you can do hair reduction. The point is the laser is not in the ultraviolet, so it will not initiate or increase or worsen the discoid lupus. This is the first point. The second point, if the vitiligo is stable, we can work on it. And I have many patients usually do test dose and then ask them to come after 1 month. If nothing happened, I can start and nothing happened. So you can work with it. The third one is atopic dermatitis. The skin is very dry, and dryness of the skin will expose the patient to post-laser hyperpigmentation. So we should use moisture before using the laser, but it will work and it has no effect on the activity of the disease. So we, yes. Yes, keloid patients, we can work on them because there is no, it's non-invasive, it's superficial, there is no injury. So we use, we minimize the fluence, but we can work. And usually work in small spot size first. This is the rule.
At the beginning, I can add, at the beginning, if there is some problems, we can begin by test dose in specific area and follow up for the patient in the next session, and we can decide we will continue or we will stop if there is any reaction.
I think this is published data about such patients, and all are agree about that. Please postpone any procedures like that laser hair violation sorry, for 6 months after inactivation of disease. Yani disease come inactive, stable, ready, 6 months, do what you want. What I want to raising now an alarming things. We notice that now there is non-sexually transmitted human papilloma virus in the genital area. And I think that the sterilization of the probe for the laser hair ablation is very, very, very important. Is it enough just to wash it with water and soap? Is it enough to put it inside? We don't know. So I want to ask Mr. Dr. Ashraf about that and your advice to minimize. Now the percentage high, in some area, in countries, a lot of patients.
Okay, I'll let Peter answer that, but before we go to that question, I would like to comment on the previous question. A couple of comments. Any disease with Koebnerization, with Koebner phenomena is a contraindication for laser. So if the patient is having lichen planus or vitiligo or psoriasis or any disease with Koebnerization, if the patient is having Koebner phenomena, this is a clear contraindication for laser. This is number one. Vitiligo with no Koebner phenomena, if the hair is still black, we shouldn't remove that hair, because if the patient is seeking repigmentation, this is a valid and very good source for repigmentation. So we should not remove the hair in this area. As Dr. Abir mentioned, patients with atopic dermatitis, they have dry skin. And when we do the laser on dry skin, this is going to precipitate burns and then hyperpigmentation. So if the dry skin due to atopic dermatitis or isotretinoin treatment or just because of the weather, we have to moisturize the skin before we start doing the laser assist hair removal in order to have smooth effect. So those are a few important. The photosensitizing diseases or medications are not contraindication for hair removal, because with hair removal we are not using excimer laser, we are not using ultraviolet laser, we are using lasers in the visible spectrum or infrared. So this is not an issue. It might be a problem if you are doing ablative laser or something which is going to create wound in an area which is exposed to the light, because the healing is going to be followed by post-inflammatory hyperpigmentation because of the photosensitivity. So those are the considerations. Now, Peter, the question is for you. Human papillomavirus can be transmitted through the handpiece of the laser. So what do you do in order to avoid that?
Yeah, well, that indeed is a very good question, and it's actually it's not only the handpiece, but there's going to be a plume of particles coming from the skin with any type of laser, unless you put on a glass that where the laser beam goes through and there's no real contact. That's the only way to do it in a safe manner. And then, well, afterwards, you if you don't do that, you really have to sterilize your handpiece by putting it in alcohol for a certain amount of time.
Actually, this is something new. I never considered that. I was thinking that the contact handpieces are the only source of contamination. I never thought that the plume can lead to contamination. This is a very valid point. In this case, it's important to use a smoke evacuator while we are doing hair removal in any area we suspect that there is human papillomavirus infection. Is that what you suggest?
That would be the ultimate solution, but I think nobody's doing that actually.
Yeah,
that's fortunate.
I hope Albert is back. Albert, are you back? Actually, we are publishing now a study about the smoke evacuators and how to use and what is the optimum usage of that with the different applications. Dr. Mona.
We have a study in the National Institute of Laser from the early beginning in the institute, and we found that there is viral particles in the smoke and the plumes.
So do you recommend
it's
that
done.
we do
It's done. Yes, smoke evacuator and with cautery also.
With hair
we
removal.
have to use smoke evacuator.
With hair removal. Do
Yes,
you use smoke evacuator?
because sometimes there is more smokes. We have to, if there is any viral infection not evident or appeared,
who
we
is
can
doing
use it.
laser assist hair removal here? Can you raise your hand? How? أيوة بس يعني